simply put, is that high dose of medications will decrease risk of heart disease by about 50%, and I'll show the data a little bit later. So to me, is that one of the most important things you need to do is good lifestyle changes, and if you're at high risk for heart disease, get your cholesterol very low. And what happens is these medications block in the liver, which is an important component of how your body manufactures cholesterol, and it blocks that, decreases your cholesterol through that mechanism. Now, if you want to look, if you look at the internet, is that if you Google cholesterol, you're going to say that, that doctors are in cahoots with the pharmaceutical industry. It's the most prescribed medications. They don't know what they're doing, but the bottom line is why it prescribes this, it works. There's different levels of scientific data. One form of science is observation. You observe what happens to your neighbors, to your friends. That's a weaker form of science. Let me give you an example. Beds are associated with mortality. People die in bed. More likely than walking around. Absolutely true. But do beds kill us? So beds are associated with deaths, but they don't kill you. Unless the bed sort of gets up and kicks you in the butt or something of that nature. These are things called randomized controlled trials, where a computer selects therapy. And this is the strongest level of evidence. And so basically, 170,000 people randomized to a cholesterol pill or not, showing that for every 1 unit or millimole of reduction of LDL cholesterol, cardiovascular events fall by 20%. The low dose of a cholesterol pill called a statin, Lipitor, Crestor, the 2 superstatins, decreased cardiovascular events by a third, high dose by 50%. Holy you know what. Here's a therapy that in properly done science can halve the amount of heart attacks and strokes. That's amazing. It works in males, works in females, works in younger people, it works in old farts like myself. I consider myself part of the old farts club now. That means is I can fart anywhere I want to, no questions asked. Doesn't always work that way, but as you get older, you can do these sorts of things a little bit more, I think. But this is actually really amazing that half of heart disease can be removed by high-dose cholesterol pills. And people say, do I have to take the highest dose of medications? This is the best dose of medication. And the benefits are independent of the starting cholesterol. It's a level of risk important. So if you have sugar diabetes, early age of 50 years of age, a couple of risk factors, you already had a heart attack or stroke, then you're at high risk of a heart attack or stroke, and that can be reduced dramatically. The problem is that most people stop their therapies. Oh, I'm special. I don't really need this medication. I'll be okay. The reality is 70 to 80,000 people every year die from this process. If you're male, 2 in 3 above the age of 50 will have a future heart attack or stroke. If you already had one, you're going to have another one. Females, 1 in 2. So this is important. And I understand is that, I'm kind of busy. I don't want to go for a renewal. Do I really need to take this? The answer is yes, if you want to prevent a heart attack or stroke. Now, if you want to die of a stroke, heart attack, by all means. These are the medications. Now, people say, what about side effects? There was 10,000 patients taking the drug called simvastatin and Zocor, and close to 3,400 patients developed side effects, 1 in 3. Why would you take a medication that 1 in 3 people will get sore muscle problems? Look at placebo. Placebo is a sugar pill. It's a very dangerous drug. 1 in 3 people on a sugar pill get soreness. All the way through. 1 in 3 people over the age of 50 years of age are sore. Arthritis, aches and pains. Oh, look, I play squash and I've overplayed, I get tendonitis. It's not the cholesterol pill I'm taking, it's I just overdone it. And so there's an entity called rhabdomyolysis, a very rare event. But unfortunately, life makes us sore. And the side effects, what can happen, you can see that background noise is much more common in this situation. And the fact that I might drink too much and I have fibromyalgia, arthritis, these are the reasons why I can be sore, have aches and pains in life. Next slide, please.